people's attention. Today, we have quite a special guest, Bishop Dr. Frederick Shaw. Bishop Shaw is the presiding bishop of the Evangelical Lutheran Church of Tanzania. So the entire country. In addition, he oversees the Good Samaritan Foundation. GSF owns KCMC and the Kilimanjaro Christian Medical University College. And as you know, this is one of our principal partnership locations. So Bishop Shaw is here this week to visit with us, to talk to us, to get to know us better. And so we're so pleased he's here. And of course, he's joined by his wife, Mrs. Janet Shaw, and also Dr. Gilliard Musinga, who is the KCMC Executive Director. So today, Bishop Shaw is going to talk to us about an important topic, faith-based healthcare delivery. So, Kailusa.
Thank you very much. Thank you, Professor Bartlett. It's my great pleasure and honor to be here and to speak to you. But I'd like to thank you very much for the invitation and also for coming and your interest. I've been asked to talk about the role of faith-based health delivery in Sub-Saharan Africa, but I will specifically speak about the role of the Evangelical Lutheran Church in Tanzania, but also the churches or faith-based organizations in the country, Tanzania, because that is where we live and what I know better. So, speaking of the role of the faith-based healthcare in the country, one has to go back to the history to see why faith-based healthcare. One has to talk a little bit about the history of mission in Sub-Saharan Africa in Tanzania. When the first missionaries came, mainly the Lutherans, the Catholics, and the Anglicans, when they came to our country, for example, wherever they established a church, there would also be a school or in the healthcare center, a hospital, a dispensary. And this has been the marks of the existence of the churches in our country. But I would first of all want to talk about Tanzania, our country. Tanzania is a big country, not as big as the United States of America, of course, but it has a population of 54 million people, in growth, population growth of between 4 and 4.5, the annual population growth. Tanzania has its political capital and Dodoma, which lies in the central part of the country. Show it there, and but we have Dar es Salaam as a commercial capital of our country. Tanzania is an area of about 364,900 square miles, which compared to your states here, it's a little bit more than twice the size of the state of California. The literacy percent in Tanzania is 78. And in Tanzania, we have more than 120 ethnic groups. And when we talk of ethnic groups, we are talking about people speaking different languages. 120 ethnic groups. One of the, I would say, uniting factors in our country despite these different ethnic groups, we have Kiswahili. Swahili is a common language for all Tanzanians, so there is no problem of communication no matter where you will find yourself in Tanzania. If you know Kiswahili, you can get through quite well. We are blessed with natural beauties, with natural what we call reserves and national parks where you find many animals, not in the zoo, but freely living in the parks, in the reserve area. 30% of our country is really occupied with these national parks, 12 parks and 13 nature reserves. And therefore that makes Tanzania, the tourist industry is one of the major resources for the income of the country. Tanzania is divided administratively into 30 regions, and 161 districts and 183 councils. And this is important to note because even this healthcare provision is divided or distributed so in terms of the regions, of the districts, and councils. The economic growth of the country is 7%, but one has to note here that it is when it comes to the overall is 7%, but when it comes to the low income and population of the country, of course it is lower. It is much lower for the majority of the people, especially living in rural areas. The per capita, Tanzania is $695, with 30% of the population living below poverty line. In Tanzania, the provision of social services is the responsibility of the government. Although, due to very strong involvement of churches, and especially faith-based organizations, sometimes people think that it is a responsibility of those organizations, but it is made clear that it lies with the government to provide health care for its people. Since the 1960s and even before, as I said, before the political independence, Tanzania, the faith-based organizations, mainly the churches, have been key players in the provision of health care. And after the independence, the church churches have been supplementing the government in the provision of social services such as health and education. I'll talk a little bit about the basic facts about healthcare delivery in Tanzania. In Tanzania, we have 8,215 health facilities, which are public and private, with 50,862 bed capacity. In 2015-16, the doctor's-patient ratio was 1 to 18,000, which is, as you can see, compared to here. I don't know what is the ratio here in the United States.
There are 800,000 positions, so 1 to 350.
Yes. Yeah. So we are way, way back, and we still have a lot. You can see that Pharmaceutical services are provided by public and private providers. 80 out of 102 of church health facilities have service agreement with the government, whereby we have entered an agreement. The government provides most of the staff, and the church provides the rest of the running costs. There are 44 health centers and dispensaries with services agreement all over the country. Those 44 health centers which belong or are owned by the church. They receive subsidy, human resource, and medicines from the government. And here you can see the distribution and the percentage of health facilities in Tanzania. Most interesting is when you look at the hospitals, the number of hospitals, you'll find that the government owns 95 out of the total 240 hospitals, whereby almost half of the hospitals are run by the churches, and here we talk of the Protestant churches and the Catholic, the Roman Catholic Church. 102 hospitals, and most of these hospitals, almost 60% of them are found in the rural area. So we reach the remotest area in the country. And sometimes it has been a challenge to get medical staff to go there, because everybody wants to live and stay in an urban area. In the cities, it's more attractive. There is more electricity, reliable source of water, and clean water, and so on. So it requires a lot of determination and conviction to send people to work in these rural areas of the country. All in all, you can say that when you look at all health facilities in the country, the church and FBOs, we run about 15%, 14.7% of all health care facilities, from hospitals to dispensaries. Now, what is the involvement of the Lutheran Church in healthcare provision? By December 2016, Tanzania had more than 900 healthcare facilities, 696 dispensaries, and 102 health centers and 102 hospitals owned by the church. ELCT, and when I talk of the church, I'm talking of the three mainline churches, the Roman Catholic, the Lutheran, and the Anglican churches. But the ELCT, the Lutheran Church in Tanzania, owns 23 hospitals. And we have 140 health centers and dispensaries which are spread all over across Tanzania. And in addition to that, the church is also engaged in primary health care, in diaconal, and HIV counseling, and the provision of primary health education, treatment, and palliative care at the national and diocesan levels. And here you can see, when we take a particular look at KCMC and Bugando, two of the four existing referral hospitals in the country. We have one, KCMC, which is owned by the Lutheran Church, and Bugando, which is owned and run by the Catholic Church. These are two referral hospitals, and now the government owns and runs two. One in Dar es Salaam, Muhimbili National Hospital, the referral hospital, and one in the Southern Highlands, which is a Mbeya referral hospital. Now, you can get more information about these consultant hospitals or referral hospitals. Both were opened in 1971, and the government under Mwalimu Nyerere, the former president with a socialist policy, nationalized all these institutions. But after long negotiations, these institutions were handed back to the church in 1992. As I've said, KCMC is situated near Mount Kilimanjaro, the slopes of Mount Kilimanjaro, for those who have been there, or Moshi, very well. And Bugando is the lake zone near Victoria, Lake Victoria. KCMC has 628 beds, and Bugando has 950 beds. Whereby KCMC has 1,300 employees, and the same number is also for Bugando. And when we talk of the northern zone, it caters for I don't know how many regions.
5 regions.
Yeah?
5 regions.
5 regions in the northern zone of the country. So we are talking of about 15 million people out of the entire population of 54 million in the country. 15 million are taken care of by a KCMC hospital. Yeah, both hospitals, as I've said, they have a memorandum of understanding with the government. Now, about the best practice of training of health professionals provision by faith-based organizations, I will cite a case of Kilimanjaro Christian Medical University, which has been a partner, a partnership with Duke University, and also the Catholic University College of Health and Allied Sciences at Bugando. The KCM College, University College, is owned by ENCT, which is itself is a constituent college of Makumira University, which is one university owned by the Lutheran Church. And the college became operational since 1997. And here, one needs to talk about the vision of the founder of the Good Samaritan Foundation, the founder of the Kilimanjaro Christian Medical Center, KCMC. Bishop Moshi was the bishop of the diocese and also the presiding bishop of the ENCT. He had this vision of having a center, a healthcare center where these 3 elements would run together, which is the treatment and training and research would be carried out. So we started with the hospital, and then we had the college, the university college for training, and now we also have a research department of the hospital, which is a Kilimanjaro Christian Research Institute. And we have 3 faculties and 2 directorates: the Faculty of Medicine, the Faculty of Nursing, the Faculty of Rehabilitation Science, and then Directorate of Postgraduate Studies and Directorate of Research and Consultancy. The same you can see also compared with Bugando, where they have 4 schools. The Bugando School of Medicine, the School of Pharmacy, the Archbishop Anthony Mayala School of Faculty of Medicine, and School of Public Health. So in summary, you see that the Lutheran Church in Tanzania has one university, which is called Tumaini University, Makumera, and four constituent colleges, which are Kilimanjaro Christian Medical University College, and Stefano Moshi Memorial University College, and Josia Kibera University College, and Tumaini Dar es Salaam University College. And we have also 52 new-local health training institutions where we train nurses, we train medical assistants, and clinical officers. Now, what achievements we have? One is that the government has recognized our services, and our facilities also really provide a reliable center for trainings of clinicians. KCMC is a home for 14 colleges of allied health sciences. Bugando Medical Center also has a university and several colleges, as I've said. About 1/3 of all regional medical officers and district medical officers school have been schooled or were schooled at KCM College. And this is something we are very proud of. We go all over the country, and we want to see the regional medical officer or a district medical officer. You will find that he or she was trained at our college. And we are quite proud of this, really. And we want to really thank you for the cooperation. You have contributed, Duke University has contributed a lot in enabling us produce, would say, first-class students in our country. So 1/3 of those who are holding very key positions in the provision of healthcare, they have gone through our college. As I say, we provide almost healthcare to about 30 million, 30 plus million of Tanzanians. And now the KCMC hospital, people do not only come from the northern zone, they also come from all parts of Tanzania. When you look at, for example, the ophthalmology department or eye treatment and operations, and people will come not only from across the country, but also from the neighboring countries like Kenya. We have people coming from Uganda and Rwanda to get treatment at KCMC. So we have this improvement of super specialized services, both at KCMC and Uganda, and both hospitals have introduced oncology services. Bugando Hospital is about to start offering radiotherapy. At KCMC, we now offer chemotherapy. Dr. Masenga, our director, will talk more about that and the challenges we are facing, but we are really grateful for the achievements we have in the hospital. We are also leading in some services. For example, the ophthalmology department is the best in the country among public hospitals. We are key players in the countries. Clinical research is through Uganda Medical Center and Kilimanjaro Clinical Research Institute. What challenges we face? When we look at the hospital and the growing number of patients compared to the available facilities, sometimes it is shocking for people coming from countries like you, where you have very advanced medical care facilities, and you come to KCMC and you find patients in the surgical department, for example, in the surgical wards, they have their beds there on the corridors. We find beds for the patients, and even some patients they are forced to share one bed, two patients. So it's the situation and the challenge we are facing. We have many patients who do not have any kind of health care, health insurance, and they are not in the scheme. Only recently we were talking in the board, but I think 87 million Tanzanian shillings. We call them abscondees, and the patients, they come, they get treatment, they just do like they are going to, at least just for a walk, but they go completely, and they don't pay for that, you know? And so we have to tolerate that. And then we have limited inpatient ward spaces, shortage of medical equipment such as MRI, and absence of radiotherapy unit at KCMT. And we are really hoping that after establishing the cancer care center, we see the need. We see the need, a great need. People have to travel all the way to Dar es Salaam, and they have to wait for months until the disease has reached a very bad stage before they can get an appointment for treatment. Dar es Salaam. So it is an urgent need, and that the cancer cases are on the increase. And then we have a great shortage of human resources. These are some of the challenges which we are facing. So I want to thank you very much. In brief, this is what we can say concerning the contribution and the role and the challenges we are facing as a faith-based organization. But we really thank God, and everybody appreciates the contribution of churches and faith-based organizations in the provision of health care. Thank you very much.